And welcome to Arthur Elementary's virtual parent night. I'm Mary Frances Moore and I'm the school counselor, and I appreciate all of you willing to join us as we cover a special topic that we wanted to address about childhood obesity. In this presentation, there will be lots of links to resources and information for you. We will make sure to send this out to you at the conclusion of this meeting, as well as present to you a virtual flyer that has more concise information and resources for you. So let's begin on the topic of childhood obesity, learning more about what it is, who is at risk for it, and steps and tips that you can take as a family to increase overall healthy habits. Okay, some quick facts. 1 in 5 children in the US have obesity. That is 14.7 million youths aged 2 to 19 years old. The highest prevalence is in Hispanic children, and then in non-Hispanic Black children, non-Hispanic white, and then non-Hispanic Asian. Childhood obesity is having a BMI or body mass index at or above the 95th percentile for that age and sex. Main risk factors for who could be more susceptible to childhood obesity. I selected the main 4, but there are more. Number 1 is eating habits. So, children consuming foods with high amounts of added sugar, saturated fats, and sodium. A lot of these foods to us look like fast food, processed snacks, and sugary drinks. Movement. The CDC actually recommends kids receiving 60 minutes of physical activity daily. So kids not receiving that physical activity could be because they're spending excessive time watching TV, playing video games, and scrolling social media, which is good in moderation, but done in excessive amounts can actually impair the amount of time that they could be doing something physical for themselves. Mental health. A child undergoing personal or family stress could have altered eating habits. It could be a tragic event that's occurred in the child's life, a tough season of change and transition for a family. Um, it is shown that higher stress levels is higher cortisol levels, which can actually increase hunger. And then medication. Some prescription medications can contribute to weight gain for children. I included a link to the Mayo Clinic that has a list of a few medications that if you notice a change in your child's weight, you can consult with your doctor about the medication. Medical concerns. So, obviously, our priority for speaking to you tonight about childhood obesity is because of the long-term medical side effects or conditions that arise in conjunction with childhood obesity. So, students or children with obesity are more likely to develop preventable chronic diseases like type 2 diabetes, high blood pressure, asthma, some mental health illnesses, depression and anxiety, or physical pain like muscle and joint um, achiness. Children with obesity are more likely to also become adults with obesity, which continues to increase their risk of chronic illnesses, higher medical costs, and poor long-term health outcomes. So we as a school and hopefully as a school community are committed to hopefully changing the outcome of someone's life by prioritizing this issue. Tips for children. Okay, so these are things that to consider implementing with your children to increase their overall health. Sleep. Children and teens actually require more sleep than adults. And poor sleep can lead to more hunger and less physical activity. Screen time. Reducing time in front of the phone, tablet, or TV frees that child from doing repetitive sedentary tasks and encourages some more physical opportunities, which can also lead to better sleep. Healthy eating habits. Healthy eating habits are not just good for weight loss, they have extreme health benefits like boosting immunity, brain power, and strengthening bones. And then staying active is the same. It has so many benefits outside of just losing or maintaining weight. It's good for your heart, your muscles, your brain, and your bones. And like I mentioned earlier, the CDC actually recommends 60 minutes of physical activity a day. Luckily, at school, PE is interwoven into your child's um, daily schedule. And so you're looking for like a 30-minute window outside of school that your children should be staying physically active. Family fitness. So these are some tips for the whole family on how to raise healthy habits in your household. Make an activity calendar. You could walk outside after dinner, go to a local park on Tuesday nights. Make something physical that the whole family can look at out during the week and get excited about. Along with that is having activity goals. Maybe the goal is that we're going to be physically active for 30 minutes for 3 nights out of the week. Track your progress. Make small rewards for reaching milestones, like buying a new sticker or a new magnet for the fridge every time you reach a weekly goal. Invite friends and neighbors. Have them participate in family activities, like setting up kickball nights or inviting everyone to meet you at the park on a Saturday morning. And then additionally, ask your kids for their ideas. They're doing things in PE or after school programs that they might want to also do at home. Or they might even suggest a jump rope competition in the driveway. Families model healthy behaviors for their children. I wanted to touch note before we conclude our presentation on just some other things to keep in mind about the emotional and spiritual impact of food and healthy habits. So, like I mentioned earlier, family health impacts a child's physical health. Be mindful of the outside stressors, whether at school, at home, or in a different environment, that could be impacting your child's physical health. Weight, healthy lifestyle, or a non-healthy lifestyle for that matter, can be an emotional and sensitive topic. Evaluate how your family addresses food when going through times of stress. And then there's also cultural considerations. So many cultures celebrate gathering with family and friends over food and might have less of an emphasis on certain weights or certain getting certain nutrition out of different foods at each meal, which is totally okay, but things to keep in mind when evaluating your family's health plans and where they can adjust to overall lift up your family's health. I also wanted to note that along with the risk factors mentioned earlier, like eating habits, staying active, movement, there are factors outside of a parent's control that are contributing to your child's health, overall health. And that could be genetics, hormones, family habits. I would recommend consulting your doctor and asking them for their resources if this is a present concern in your life. Lastly, I just wanted to touch very briefly on a few resources. Building Healthy Families is a 12-week program that families can enroll in and work on together to gain physical knowledge, nutritional knowledge. Um, and so there's a link there. Fit Together um, looks at your local parks and recreations and plugs you in to different programs that they have locally that you could have your kids be involved in. How to talk to your kids about weight. This is a really great PDF with really great resources for parents on how to have a conversation about weight or health with your child. And then ideas for planning healthy meals or having cooking instructions is healthiergeneration.org. So thank you all so much. I wanted to include my references just so that you know that all of this is coming from available resources online. Like I mentioned, I will send this out to you. I will send out a flyer. But I'm so glad that you joined us tonight. And if you have any further questions, you of course can reach out to me individually. I'm a resource at this school for you and your child always. So thank you, everybody.